Hi, and welcome back to my YouTube channel. I'm Vita Luca, and today I'm giving you an update in regards to my genetic testing, benign congenital hypotonia, stuff that I've been trying to figure out. So, I have two other videos on my YouTube channel in regards to my benign congenital hypotonia, so if you want a refresher, please go watch those first and then come back to this one. So what ended up happening was after I got that original 3-month genetic test, about a year later I decided, I was like, you know what, no, I'm not happy with those results. I think there's still something here. My grandfather was just diagnosed with cancer, RIP, he is gone now. I managed to get a second opinion from a GP, to have another referral to go to a different geneticist. And so I went to this other geneticist the minute I walked in, and I was like, I have benign congenital hypotonia and I'm hypermobile. We start doing immediate tests for Ehlers-Danlos syndrome. Like, she's sitting there and she's like checking my hypermobility, you know, we're doing all of this. She's like checking me for atrophic scars, which I have two. I have one from my first surgery, and then I have one on my hand from a rabbit bite, which honestly, I don't know if they would have atrophied if I actually got stitches in this hand and my stitches stayed better in this arm. I don't know. They're my only two for now. I have tons of scars. The rest of all healed just fine. Those two are my main issues, and they're not even large. They're like really tiny scars, but they're atrophic, like 110%. So we were doing those tests. We were going through like just everything in regards to Ehlers-Danlos. She was like, yeah, okay, let's do a 9-month test. We'll take your blood, we'll check it in 9 months time, and we're going to look for all connective tissue disorders, all variations of Ehlers-Danlos, and then also Marfan and a few others. So it's like, yeah, okay, let's do it. Because at that point, the only thing that I felt like I fit into was Ehlers-Danlos, because I've had hypermobile Ehlers-Danlos specifically, which there is no genetic test, but you do kind of have to rule out that you don't have a different type of connective tissue disorder in order to like check a box for that one. So right now, through the entire scope of Ehlers-Danlos, the only box that I don't check is that I've been diagnosed with hypotonia as a baby, and I still have issues with it to this day, though I don't know if that is like the connective tissue, if that's the ligaments, if that's my muscles itself, but doctors like to just bake everything in and be like, oh, your shoulder dislocates, that's the hypotonia. So I don't know. I've had like 10 dislocations. I have the weird papules. I'm very hypermobile. I check off all the boxes on the hypermobility. I have 2 atrophic scars. Oh, I think I have soft velvety skin, and it's quite stretchy in my opinion, because even as a child, like, I used to have people like pull on my skin all the time, and I would just be like, I'm just skinny, as in like, I just have a lot of skin. Oh, and I have chronic pain, both my knees and my shoulder. My shoulder gets fixed after I have surgery, for the most part. It did last time. So yeah, I check all the boxes for Ehlers-Danlos. So anywho, we go through the 9 months. It comes back negative for everything. But she's like, you could still have hypermobile Ehlers-Danlos syndrome. That is a possibility, but it's incurable, and there's no genetic link, so I'm not going to diagnose you with it, but it is still in the realm of possibility that that's what you have. So I've discussed it with a GP. She actually put it on my file. I was surprised. I was like, okay, I guess I have a diagnosis. I don't know, but it is on my medical report now. But yeah, that's kind of where it's come to. So everything has been essentially ruled out except for hypermobile Ehlers-Danlos syndrome. So I could just be somebody who had hypotonia and has no problems, or I have Ehlers-Danlos syndrome, hypermobile Ehlers-Danlos syndrome. Now, the test that I mentioned in my other video where I was talking about updates for my surgery, the test that I had for that one was a head-up tilt test, which I was like, if I get diagnosed with POTS, I 100% have Ehlers-Danlos syndrome, because I've had fainting spells my entire post-pubescent life, I guess. Like, it started after puberty. Well, the other thing is I don't have POTS, FYI. I have mixed syncope, which is a subtype of vasovagal syncope, which is just you faint with triggers, and I've always known my triggers. When you faint so many times for specific things, you kind of just realize maybe that's a trigger. So my triggers are specifically pain, which is why it started at puberty with period cramping, lack of nutritional food, because I could eat something, but if it is not over like 500 calories, it's like I ate nothing at all. What happens is when I have those two symptoms combined, I get a wave of heat over me and everything just starts going dark. Vision loss, then hearing loss, and then apparently I'm on the floor. So my mixed syncope is my blood pressure drops, and then so does my heart rate. So I won't faint for just having low blood pressure, which is really good because I always have low blood pressure. But I will faint if I have low blood pressure paired with a low heart rate, which is kind of nice. I'm never going to faint if I'm exercising, but also can't really exercise in the first place right now. But yeah, these are good things to know. And actually my GP was also glad that I got it done before having my second surgery, because she's like, actually, this is valuable information for the anesthesiologist, because if they can watch your blood pressure and then know how to like mitigate issues and stuff and keep the room at certain temperatures and whatnot. And the reason why I say it's mainly like hunger and pain is because the heat, it doesn't need to be hot. I will just become hot out of nowhere. Like everything is dry. And it's basically like rapid dehydration. I don't even know if that's a thing, but it's just like all of a sudden I have a dry mouth, my lips are chapped, I got nothing. I just feel like I need water. And in my test, my blood pressure got as low as 38/14, and my heart rate was 43, and that's when I fainted. My beat per minute was 43. When I did my Holter test, because you have to do the Holter test like before going, which is basically they strap you up to a machine, you wear it for 24 hours, and you bring it back, and they read the results. Yeah, when I sleep, my heart rate also gets down to 40. Quite interesting. And like I said, I always have low blood pressure. If it's over 100, that's a great day for me. Story of my life, I'm petite. I'm very, very petite. I am the size of a 12-year-old as a 27-year-old. So, and then also how I manage my mixed syncope is drinking 3 liters of water a day and getting lots of electrolyte. That's what they told me. And to avoid magnesium, because magnesium will lower my blood pressure. So the things you'll learn after finally seeing the correct doctors and the appropriate ones after 27 years of life. It was a really cool test. I recommend it. If you faint, I recommend it. And it was so funny because I like walked in there and they were like, do you have any questions? I'm like, we just go till I faint. And they're like, yeah. And I'm like, yeah, okay, cool. Let's go. Let's figure it out. But I didn't end up fainting until they gave me the nitroglycerin. And even then it was like 5 minutes into it. I was fine as long as I was like having shallow breaths. And I took a big deep breath in and I went, oh, ho, 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 this kicked in. It's a good test to have because then they figure out why and when you faint. Because there are people whose heart completely stops, which my GP was glad to find out that was not me, because then you'd need a pacemaker. Went for POTS, found out I had mixed syncope, but it was funny. The neurologist thought that I had a form of vasovagal syncope. When I was telling her, she's like, it just sounds like you have vasovagal syncope. And I'm like, maybe, I don't know. I'd rather go and find out. And then, yeah. Turns out mixed syncope. I have 2 variables instead of just low blood pressure or some other reason. There are risks to every test, so you should evaluate your risk before getting any tests done. But if it's on the table, like a cardiologist recommended it to you, evaluate your risks and think about it and see if it's right for you. I would recommend it, at least in the Czech Republic, because I had a great team of doctors there. And yeah, they act fast. They really do. But of course, you could die, depending. There's risks to everything. And they are going to make you faint to figure out why you faint. Well, that's my update on the genetic test. And then also to just add into the mixed syncope. We're gonna just roll with that it's hypermobile Ehlers Danlos syndrome for right now until they find a genetic link and then I can actually go and get tested. I don't know what it is. Maybe it is nothing. Maybe it is a freak accident. It very well could be. But I know a lot of you guys come here looking for hope and light for your own children, that hopefully one day they could be like me. But like I've mentioned in past videos, it greatly depends on why and what your child has. But at the end of the day, your child's not their condition. They are still just as valuable as anybody else, and I want you to know that. And I want anyone who has any of these watching this, that you are more than just your condition, and you can be whatever you want to be as long as you work hard enough for it. But also, if you're still here for benign congenital hypotonia, there's 500 conditions that it's linked to. So yeah, like I said, it could be anything or just a freak accident. But that's all for this video. I'll see you guys in the next one. Bye! So if you'd like, you can watch my original hypotonia video here, or you can go and watch whatever YouTube recommends you.